All right, well, everyone, welcome to our fourth session of the day with Dr. Robert Strang, the Chief Medical Officer of Health in Nova Scotia. I'm just going to let him take it away from here so we can get cracking.
Sure. Thanks, Lacey. Good morning, everybody. So I'm going to just spend a few minutes talking about the Nova Scotia Radon Working Group, bit of the history and what has been accomplished through that group and the value of that group. So let me just, there we go. So our Radon Working Group, it was actually established, led by Pat Wall. If any of you remember him, he was the radiation kind of specialist in Department of Environment years ago. So in early 2000s, we had an issue of lead-210 being detected in school drinking water. And as we started to investigate that, the cause of the apparent lead-210 was actually radon in the water, and the samples were shipped to Saskatchewan, I believe, if my memory is correct. And it was the decay of the radon into lead-210 during that shipping process. So really, the lead-210 was really an artifact from testing, but it highlighted the issue around really around radon as the primary cause. So there was a number of things done there in terms of starting to test public buildings, raising awareness around for homeowners around the issues around radon and the need to test. And this, was the development of the radon map started as part of this initial group. It went in high. After a number of years, it kind of fell. Pat Wall retired, and the whole process kind of went dormant. But the issue of radon certainly didn't disappear, and so the group was reestablished in 2018. And the primary kind of motivator for reestablishing that group was really to pick up the work on awareness, especially as the Radon Awareness Month and the need to have some coordinated activities. And of course, so I have been chairing the group since 2018. And of course, during the acute phase of the pandemic, we were unable to make this a priority to continue this meeting. Some of the work certainly continued. So that's the background, the history, and the overall mandates from our terms of reference is to work to reduce radon-related lung cancer by developing an action plan. And sharing this radon information with the general public to really promote residential home testing as a key mandate. So we have a number of folks there from government departments, certainly health and wellness, the public health branch, environment, climate change, natural resources and renewables, public works, and the Nova Scotia libraries, who are part of the Department of Community Health. Communities, culture, tourism, and heritage. And we also have Health Canada as an important partner, and then we have Nova Scotia PEI Lung Association. Just going to go to the next slide. Oops, sorry. Trying to figure out how to change slides here on this. There we go. So in a bit more detail, so our objectives are around increasing awareness and to leading to, with the objective of leading to folks taking action and where necessary for testing of their homes and where necessary taking advantage of mitigation programs. Secondary to that, we've done work in various ways to increase access to radon testing, reducing some of the costs. And then building our stakeholder network. So a number of folks have whether government departments with their own mandate and interest in this, and then certainly a major for Health Canada, a major issue, and then Nova Scotia PEI Lung We certainly all believe that it's much more effective to be working collaboratively and synergistically rather than each of us doing our own thing in a silo. And so really that, I think we've shown some success in that area, still lots more to do, but really it's about working together in the key areas of raising awareness, increasing access to testing, and a subset of that is certainly within government is making sure we're attesting government buildings as appropriate. So what have we done so far? Every year, we talk about key pieces. We coordinate our awareness activities, certainly within the government departments, making sure that we're working together on any radon awareness information that is on government websites. And we certainly have a focus on coordinated activities during Radon Awareness Month in November. I think there's been some really interesting things come out of the working group around increasing access to test kits. The library loan program, which a number of other provinces now have, started in a partnership with Nova Scotia PEI Lung. We now have a number of test kits, short-term test kits they are, however, that people can check out of a library just like they would do a book. And that's been a successful program for sure. As I said, other provinces have looked at that and are adopting it. And we've continued to increase the number of test kits that are available through the libraries. Nova Scotia PEI Lung also has a program around increasing access, and people can obtain a test kit through their program. We were making some progress in terms of home inspection. That's kind of gone by the wayside over the last couple of years. That's a piece of work we need to pick back up again, but certainly continue to work on at the point of purchase and transfer of a home and when people are getting a home inspection. There's a requirement for home inspectors to talk about and identify the need for water testing. And we would like to see the same for radon testing as well. There has been coordination between the government departments on the testing of public buildings, including schools, hospitals, etc. And that has been ongoing work to ensure we have that appropriate testing. All of the data, and you just had a presentation on this, but we continue to make sure that the testing data is linked into further enhancing and increasing the accuracy and specificity of the Nova Scotia radon map. And the last piece, and again, leading the country in this, and I know the realtor sector is interested in other provinces on this, and this is really testament to the work of colleagues in Nova Scotia PEI Lung, really developing a radon education in partnership with the Nova Scotia real estate sector, and that is now a mandatory education piece for realtors in Nova Scotia, and another certainly along with the home inspection piece, very important that realtors are aware of and promoting the need for testing at the time of transfer of a home. Our next step is we just had a meeting a few weeks ago, and Cassie at Health Canada gave us a good presentation on some ideas around moving forward, where we need to consider our activities, either continuing or expanding existing activities, new partnerships to build. So we are looking at having a bit of a strategic discussion in the new year, 2023, about where we can go next with this working group. So I'll stop there. Happy to take any questions, but I do think the success of this, just in terms of bringing people together, collaboration and partnership, has shown its value, and I think will continue. Important to sustain this group and build on the successes we've had to date.
Great. Thank you so much for taking the time to join us today to chat about the Radon Working Group. Much appreciated. Let's see. I'm not sure if we can answer this one. Please explain how radon decay PB210 found in school water is linked with lung cancer, not digestive system. I don't know. Do you know the answer to that?
So I'm not a radiation specialist. I think what it really was, it's part of all I know is that the decay, the radioactive decay of radon at some point along the sequence produces lead-210. But that was a bit of an artifact. There really wasn't lead-210 in the drinking water at schools. It was the fact that the water was sitting in the sample containers and the lead-210 accumulated during the transit time between leaving Nova Scotia and ending up in the lab in Saskatchewan. So it wasn't that there was actually an exposure to lead-210 in the drinking water. It was an artifact, but it led to and started a number of activities that I've just gone through around radon exposure, which was really the problem that was identified. It wasn't that the drinking water had a problem with radon. It was just as I said, that decay over time as the test sample sat stagnant.
Fantastic. Thank you so much. If there's no more questions, we'll move on to our next one. As Dr. Strang just mentioned about Roshini Cassie as our Health Canada Atlantic Radon Specialist, she will be presenting next on some of the exciting work that Health Canada has done and all the fantastic things that they are supporting us with in the region. So thank you so much for joining us. We'll go back to our lobby and please join us for Roshini's presentation.